living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Men and women have many differences, including when it comes to health and health issues. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Today we're going to learn about some differences between men and women, including heart health and issues that affect different genders. We'll also talk about general wellness tips. Stay tuned. Welcome back to Healthy Living for Life. Joining me today is Dr. Doug Kunzweiler, Chief Medical Officer at Mountain Pacific Quality Health. Thank you so much, Dr. Kunzweiler, for joining us yet again.
Happy to be here. Thank you.
So we're going to talk about differences in health between men and women, and there is that adage, men are from Mars, women are from Venus. Talk to us about some general issues that are different between the two sexes.
Well, one of the most striking things is longevity. Since the turn of the last century, lifespan in America has been going steadily up, but there is a significant difference between men and women. Women live on average now about 5 to 6 years longer than men, and that gap has been increasing over the last few decades. So that's one of the more prominent differences.
So let's start by focusing on men's health. Talk to us about some of the issues that really affect men.
Well, men are more prone to a number of diseases than women are. Alcoholism is one problem. Colorectal cancer is an area that affects men greater than women. Chronic lung disease, gout. There are a number of things that are more prominent in men.
Do we know how men deal with these issues as compared to women?
Yeah, they deal poorly with them, which is probably why they have more trouble. Men are much less likely to consult a physician, particularly for routine care. They just don't wait until something dire has happened. And men have a lot of other social conditions that affect their health that women seem to avoid better.
Well, as a woman, I'm not surprised, may I just say that. So let's talk about behavioral health issues in men, right? So are they more prevalent?
Yeah, I think that's a fair statement to make. Men are more likely to engage in risky behavior. They're more likely to be involved in violence. They're more likely to smoke. They're more likely to have trouble with alcohol and other substance abuse. And also they're much less likely to eat a healthy diet than women are. In general, they get less exercise than women do. So they have a whole host of behavioral factors, lifestyle factors that work against men.
You know, you mentioned heart health issues with men. Is there a reason for that is genetic?
It's probably multifactorial. Certainly there's some genetic factor. We know that heart disease can tend to run in families, and often that's linked to cholesterol. Men tend to have higher cholesterol levels, and cholesterol comes in two varieties. There's a good healthy cholesterol and a bad cholesterol. Women tend to have higher levels of the good cholesterol, which is the HDL, and men tend to have higher levels of bad cholesterol, which is LDL. But all those other things that I talked about, smoking, alcohol, lack of exercise, poor diet, those are all related to heart health as well. And so that's part of why men have more trouble with heart disease. Women are not immune from it, though, especially after they go through menopause. Incidence of heart disease and stroke in women goes up pretty dramatically. And for reasons that aren't really completely clear, women tend to suffer worse from heart disease. When they have heart attacks, they're much more likely to die from it.
So it's safe to say that heart health and heart issues are really a universal problem.
Absolutely. Absolutely.
So what about steps that men could take to significantly reduce some of these heart health issues?
Well, one important one would be to seek routine medical care and have their risk factors assessed and come up with a personal prevention plan. Men are much less likely to do that. A real obvious one that would hold true for both men and women is to stop any use of tobacco products.
So in your experience, are there more men who have smoking issues, who smoke more or use tobacco products than women? Is that part of the issue, part of the problem?
That's a part of it. But unfortunately, we've seen smoking be pretty common in both men and women in the last few decades. But at least up until menopause, women seem to tolerate that better.
So talk to us about some other health issues that men and women should be concerned about, besides heart.
Well, a lot of what we want to talk about has to do with screening for risk factors and for common diseases, things like colorectal cancer, bladder cancer, other cardiovascular disease like strokes, and neurologic events. Those are things that apply to both men and women.
So when I think about women being able to influence men, either their partners or their fathers or uncles, what important tip would you give women to try and get men to do?
Yeah, the things that are helpful are the lifestyle changes. To exercise more, women often are more involved in cooking, and so that's something that they can influence. Eat more of a Mediterranean-style diet that's more rich in vegetables and fruits, whole grains as opposed to processed foods, less red meat, more fish. So that's something that women could do. But encouraging them to exercise, encouraging them to reduce smoking and alcohol usage, those are all places where women can have some effect.
So the important word there is encourage and not nag. So that's great. All right, we're going to take a break right now, and when we come back, we're going to talk more about women's health issues, and we're also going to talk about some important wellness tips. So please stay with us. Welcome back to Healthy Living for Life. We're still talking to Dr. Doug Kunzweiler, Chief Medical Officer at Mount Pacific Quality Health. Before the break, we talked about men's health issues. Now we're going to focus a bit more on women's health issues. So what diseases are more common in women than men?
Well, the obvious ones, of course, are breast cancer, uterine cancer, cervical cancer, ovarian cancer. But then there are some other diseases that are not so commonly thought of. The autoimmune diseases, where the body forms antibodies to some of its own tissue, are more common in women. And examples of that would be rheumatoid arthritis, for instance, lupus. So those are more common in men. Women are more prone to osteoporosis, bone loss, than men are. So that's another one. Both sexes are prone to depression, but women seem to have a little more trouble with that, and anxiety as well. And we know also that women suffer more from chronic pain.
So what factors are the usual suspects for women's health?
Well, some of it is biological, of course, and we don't really understand all of the reasons why women are more susceptible to those diseases that I mentioned. Especially the autoimmune, it's not really clear. It may be hormonal, may have something to do with pregnancy when they were younger. We just don't really know that. Then again, some of it are the risk factors that were already lifestyle factors that we already talked about. And in general, women do better in that category than men do.
We talked about breast cancer clearly being more common in women. And I have read recently that aspirin can impact positively your risks for breast cancer. Is that true?
Unfortunately, there doesn't seem to be much to that. 10 years or so ago, there was some thinking that perhaps aspirin was protective in breast cancer, but in the last couple of years, some more thorough, better designed studies have been done, and it doesn't appear that aspirin is protective for breast cancer.
So clearly breast cancer is more common in women. I think, we all know that. But it can also occur in men. Talk to us about that.
It can. It's fairly rare. Only a little less than 1% of overall cancers occur in men. The main risk factor that we know of is obesity. So that's something to think about. Obesity is bad for almost any disease you can think of, but it is associated with breast cancer in men.
And so obesity, you're bringing that up for sure, and it's an important topic for men and women. So talk to us about some of the risk of being obese. I mean, we're reading more about that, even as it relates to COVID, significant after effects and death even. Talk about obesity.
Absolutely. Obesity is just bad. It's a risk factor for heart disease. It's a risk factor for high blood pressure. It's a risk factor for diabetes. It's a risk factor for a number of cancers, including colorectal cancer, pancreatic cancer, breast cancer. Obesity is hard on your joints, so it's a risk factor for early degenerative joint disease. And we know that of the people who have died of COVID, a good proportion of them, maybe 70% of the people who died of COVID had obesity as a prime risk factor. And in America, we have an epidemic of obesity now, and we're seeing it in school children, which is a very disturbing trend. So it's something that we really need to work on.
So what other health issues typically affect women differently than men?
We talked about depression and anxiety. Domestic violence is something that is a huge problem for women. Osteoporosis, bone loss, menopause is something that, of course, women suffer from that men don't, that often raises health issues.
So let's talk about heart attacks and how they present. So differences between how they present with men versus women?
Yeah, absolutely. The classical symptoms that we think about, chest pain, chest pressure, trouble breathing, those are much more likely to present in men. In my experience, and I had pretty long experience in the ER, cardiac events in women, they were much more likely to complain of shortness of breath, of nausea, vomiting, feeling lightheaded, not so much the classic chest pain and chest pressure that you would see in men.
So in the minute or so we have left, let's talk about dietary supplements. So what do dietary supplements do to our overall health? Is it worth investing money in them?
To some extent, it depends on your diet. If you eat a healthy diet and you eat lots of fruits and vegetables and a varied diet, health supplements really aren't much of an issue. As you get older, sometimes people have trouble with weight loss, especially with muscle loss. And in that case, dietary supplements like protein supplements can be valuable. And in a northern climate like ours, vitamin D is really one supplement that can become an issue. We need sunlight to make vitamin D, and in our climate, there are a lot of people who are vitamin D deficient. So that's worth mentioning to your primary care provider and let them check that out for you.
That's excellent, and probably calcium for women as well if needed. So that's
Absolutely.
Great tips.
Absolutely.
All right, we're going to pause for a break, and when we come back, we're going to talk more about men and women health issues, but now we're going to switch to what you can do to stay weller, as it were. So please don't go away. Welcome back. We're still talking to Dr. Kunzweiler, and now we're going to shift and talk about annual health visits and the importance of those visits. So thank you again, Dr. Kunzweiler, for staying with us. Why is it important for men and women to see their physician regularly?
Well, if you only go when you have a complaint, something that's bothering you, that's what the physician is going to address. But if you do a regular annual visit, the real purpose of that is to help you develop a wellness plan, a preventative plan. And that's a little bit different. That involves assessing your risk factors. It involves assessing your past history, your family's medical history, to see what sorts of problems might be cropping up and what you can do to prevent that. And it's an assessment of your lifestyle to see if there are behavioral things you can do that would contribute to your health.
So let's dive a little deeper and talk about what exactly is included in that annual wellness visit.
Yeah, especially if you are a Medicare recipient, they pay for an annual wellness visit. And that has a number of things that you are specifically supposed to look at. One of which is your mental health. And so your provider is going to ask you if you have had troubles with depression, mood disorder. Another one is cognitive problems. And that is, are you having troubles with your memory? And they will probably do a little test to test your memory. And then they're going to look at all the medications that you're taking, any supplements that you're taking. They're going to want to hear about other providers that you might have seen, any surgical procedures you may have had. They're going to go into your family's history to see if there are things there that you might be particularly at risk for. For instance, if there's a strong family history of breast cancer, they're going to talk to you about the screening for that and other problems. They're going to talk about risk factors. Do you always wear your seatbelt? Are you subjected to domestic violence? Those kinds of things. Do you have any risky behaviors? They're probably going to ask you about substance abuse, alcohol, tobacco, all those things. And the point is to review all of these things in a visit and try and craft a plan for you that will help contribute to your wellness.
You know, that's really helpful. I did not realize all of that, and so it's important information for all of us to know. Are there different lists of things that our practitioner will go over with us between men and women?
Yeah, to some extent, depending on the risk factors. For instance, with men, they might be concentrating more on heart health, on alcohol abuse, risky behavior. And with women, of course, they're going to want to talk more about their particular risk factors for breast cancer, ovarian cancer, that sort of thing. So there are some differences, although there's a lot of similarity as well.
So let's imagine I haven't been to my physician for some time. Is there a list of things I should bring to my appointment, or should I bring my medication? Give me some tips.
Yeah, absolutely. Any medication, any over-the-counter supplement that you're taking, you should bring that. If you have health records, or shot records, a record of your immunizations, you should bring those along. Pretty much anything that would help to document your past medical history you should bring. And I like to tell people if you are worried that you don't remember what your doctor told you, or there are things you want to talk about that you always forget when you go to the doctor, a couple of things that can be helpful. As you think about it, write down questions for your doctor and take that list with you. That can be very helpful. And if you think your memory is a problem, bring a trusted friend or family member along with you to help prompt you to ask the questions you want to ask and to help you recall what your provider had to say. So those would all be good things that would be helpful.
Are there different types of preventive and wellness visits? So when you make an appointment, are they doing different things between annual wellness and preventive?
Well, if you're again a Medicare recipient, the Medicare annual wellness exam is somewhat scripted. The provider has to ask certain things, particularly when I talked about cognitive and mood disorders. Those are on the script that they need to ask about. But every primary care provider, even if you're not a Medicare recipient, should be asking pretty much the same thing and seeking the same information. And it's really to look for the risk factors in your life so that you can develop a preventative program.
So sometimes I've heard friends say that when their doctor is asking them about certain things in their annual wellness appointment, they really don't know what to say. They're kind of tongue-tied, as it were. So give me some advice, and our viewers some advice about some things they could open with to start a dialogue, open dialogue between me and my physician, as an example.
Well, I think, and again, it can be helpful to write some of this down, but I think the main thing you want to convey is the things that you are concerned about. If you're worried that your memory is slipping, you should make that known to your physician so that they can address that and do some testing and see if you need further screening. And the same applies to other symptoms. If you've been having trouble with shortness of breath, or you've been having trouble with maybe heart palpitations, bring that to your provider's attention so that they can go into that further. If there are family members who, had problems, say heart disease or they had cancer, you should make that known to your provider too, because all of those kinds of things can influence your risk factors and can influence the type of screening that your provider is going to recommend.
Thank you so much, Dr. Kunzweiler. We're about out of time, and thank you to our viewers for joining us. And we hope you join us again. And until then, stay fit, stay well, stay healthy for life with Healthy Living for Life. Take good care, everyone.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health in partnership with AARP Montana. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.